Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Dennis Stoda.
Dennis, as you know, twice a year, the Mayo Clinic conducts a national health checkup survey. They're taking the pulse of Americans on their health opinions and their behaviors. You know, how much have you been eating? How much have you been exercising? How much have you been drinking?
How much we have not been doing some of those things we're supposed to be doing.
The survey will show you.
Yeah, so this fall the survey focused on cancer, and it found out that more than 60% of Americans have experienced cancer in some way, either a personal diagnosis or experienced it through a loved one. Also, the survey revealed that many barriers kind of get in the way for patients and families, and what those barriers are when it comes to cancer care. And that can be financial concerns, it could be insurance, or it could just be making time to have an appointment.
Well, here to discuss the Mayo Clinic National Health Checkup is Mayo Clinic medical oncologist, Dr. Minetta Liu. Welcome to the program, Dr. Liu. Nice to have you.
Thank you for having me.
All right, we want to know about the study. Why did you do it, first of all, and why did you decide to concentrate on cancer?
So I didn't personally conduct the study, but I'm happy to talk about it. The Mayo Clinic places such importance on understanding what Americans think about their own health, that this is our way of, quite frankly, taking their pulse to understand the needs for education, to help promote prevention, and then advocate for treatment.
How is this survey conducted, and who is included in the survey?
So over 1,100 respondents were involved in this survey, and they were randomly selected by landline and mobile telephone numbers. And it was conducted by a professional company where these questions were asked and responses recorded.
All right, hit the highlights for us.
So I'm grateful as a medical oncologist that this covered cancer, because it's important for us to understand what people are thinking about cancer and what they're trying to do to prevent it, and then again, what the barriers are to care, because that's so important for us as we're trying to provide that care.
Sure.
So questions were asked, again, respect to how were you touched by cancer, if you were touched by cancer, and what your barriers might be to seeking care if you're healthy, but also if you have a diagnosis of cancer, what do you foresee as the barriers to care?
And those barriers turned out to be, as we kind of just touched on briefly, time, money, access. Did it address any ways to overcome some of those barriers for people?
No, this was to understand, again, the mindset of Americans, not necessarily to solve the problem. That's now incumbent on us here at Mayo, as well as all of the major cancer centers in the United States, and I'd argue the world as well, to try to respond. The great majority of individuals who responded to the survey did say that they felt that there was a barrier, and the most common barriers that were cited were finances as well as time.
So finances, obviously, it's a costly disease. Were there problems with reimbursement from an insurance company? Was that a barrier?
So insurance coverage was cited as another barrier outside of finances, but sometimes there's a bit of a blurred line between the two. That certainly, we see it all the time in those patients who come to see us, that they're worried about what their insurance is going to cover, what their deductible is going to be, who's going to define where they can go, right? Because some insurance providers will dictate the centers at which you can receive care. So those are the realities that we need to face as our healthcare environment is evolving minute by minute.
When you came through the door and we had a chance to chat for a moment, and we mentioned the word barriers, you said, oh gosh, time is terrible. And you would think if I get a cancer diagnosis, suddenly that's going to be the priority in my life, is to find the time to address that. But it's not that simple, it sounds like.
It is the priority we have as individuals, but there's the priority that we have just in the reality of life, right? Which is that we're all working at 150, 200%. We are all working. We're worried about taking time off from work, not getting paid for the days that we are at the physician's office. How are we going to get to the physician's office? So again, I think those are all the realities, and those are financial barriers outside of just health insurance.
The cost, and when you talk about the cost of cancer, you're really not just talking about the medical expense. You're talking about time lost and requiring help from other family members who may have to cut back on their workload, things like that, right?
Absolutely. There's an emotional cost, a financial cost, and a family cost that comes from a diagnosis of cancer. So when we say that 60% of the individuals who responded say that they were touched by cancer personally or through a loved one, when you expand that circle to the reality of people we know, it's close to 100%.
If I'm a mom or a dad and my children get ill, of course, that's a huge time commitment as well, making sure their needs are addressed.
Absolutely.
What about access? Was that considered a barrier, a difficulty for some?
Yes, and I think it was in part just access to, it's not just access to care. Again, it's the time to be able to access care.
Did you find positives or things that were encouraging in the survey that people indicated might be looking improved in their situation or their hopefulness about
Absolutely. Number one is the awareness of cancer. I think awareness will foster desires to get past those barriers of finances and access and time. Positive in that the great majority of our respondents had hope that we were going to do better and, in fact, potentially cure cancer. I, as a medical oncologist, would love to be out of a job. Right? I tell people all the time that's the goal.
Well, you were supposed to be out of a job 17 years ago, but weren't we supposed to cure cancer by the end of the last century? And it's a very difficult, complex disease, isn't it?
It is, and quite frankly, I don't know if we'll necessarily cure it, but we can beat it otherwise. People who are diagnosed with cancer, irrespective of stage, we can learn to live with it, and we can live with it well. And that's part of the advances in treatment that we are working on now.
We see that 95% of people said they're trying to do something proactive. What kinds of things are they doing to try to prevent cancer?
And Americans should be applauded for everything they do to adopt a healthy lifestyle. And that is number one, is adopting a healthy lifestyle. So the things that we can all do to, as individuals, reduce the risk of developing a cancer: eating well, not drinking alcohol, exercising, not smoking. And those are the basic tenets, again, of healthy living in general.
Were there some things that the survey taught you that you can potentially act on?
Awareness and teaching. So there were questions not only about prevention, there were questions about vaccines and tests that we can do to help screen for cancer or prevent cancer. And although there was some awareness of these, not everyone is adopting that. And I think part of it is, again, our ability to educate individuals who may not, unfortunately, have ready access to care, right? These are conversations that individuals should be having with their providers, but those individuals have to get to their providers to have that conversation. So how do we promote that connection? And that's where we can try to do better in educating the public.
So education is a big deal.
Absolutely.
Should be a big deal. And that will get people to their physicians sooner, to catch the cancer earlier, which makes it more curable.
Absolutely.
As someone who's in the fight against cancer, very directly, did anything surprise you as far as the survey went?
What surprised me, again, about 90% of the individuals said that I'm doing something to help prevent cancer, right? About half these individuals, though, said that even if something, so for skin cancer, for example, if I felt a lump or a bump, I'd be very confident to tell my provider that there was something going on, except only half of them said that I would actually go to the provider.
Oh.
And to me, that's concerning, right?
You need to act on your awareness.
And most of those were men. No doubt. We're talking about the Mayo Clinic National Health Checkup Survey with medical oncologist Dr. Minetta Liu. Time for a short break. When we come back, we'll focus on three important topics: the HPV vaccine, skin cancer, and cancers of the colon and rectum.
Plus, a myth or a matter of fact, only 1 in 3 Americans have received or plan to actually get the HPV vaccine, which it turns out can be a good way to prevent cancer.
All that when we come back. You're listening to Mayo Clinic Radio on the Mayo Clinic News Network. Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Dennis Doda.
We are back talking with Mayo Clinic medical oncologist Dr. Minetta Liu. I like saying that, Minetta Liu. By the way, how long have you been doing this?
Too long? I've been here at the Mayo Clinic for 5 years.
That'd be really good for you.
Been in practice for about 17 years.
Oh, well, good. So you were someplace else before you came to the Mecca?
Yes.
All right. Dr. Liu is has been explaining the Mayo Clinic Health Checkup Survey to us. So, Dr. Liu, we got a myth or matter of fact to start this segment. Dennis?
Yeah, is it true that only 1 in 3 people have gotten the HPV vaccine?
Unfortunately, yes.
All right, we need to know what that vaccine is.
So the HPV vaccine, or vaccine against the human papillomavirus, is a virus to help. Is a vaccine to help prevent development of the viral infection subsequent in life.
And what kinds of cancers do we now know that that virus can lead to?
The majority of cancers that are associated with HPV infection are related to the reproductive organs. Head and neck cancer is also associated with HPV infections.
That's a really sensitive topic because the primary way that men and other segments of the population as well will get throat cancer from that is through oral sex. And that's not an easy one to talk with for everyone, to their healthcare provider. But certainly the issue can be greatly reduced if you just get the vaccine.
Yeah, and I think that's a part of the sensitivity around and the lack of uptake around the vaccine itself is the stigma that can be associated with HPV by itself. To get the HPV vaccination is not endorsement of sexual activity, whether it's early or with whichever partner that you choose. It's simply a means to try to prevent the development of a cancer.
And it's recommended that children have this vaccine as well. Can you give us some of the parameters of the recommendation?
Sure. It's a series of vaccinations, and it should be started around the age of 11 or 12. It's both for boys and girls. And the goal is to get the vaccine, to get the immune system revved up before there's exposure to the virus, because you want to be able to fight the virus so it can't infect you.
It used to be that it required 3 vaccinations. Now it's down to 2, right?
Correct.
And it's important you have to get the vaccine hopefully before any sexual contact, right? Because then it's too late.
Correct.
If you were exposed to the virus before you get the vaccine.
Right. Again, it's about mounting your immune system before exposure to the virus.
And the other thing I think that's interesting for our listeners to know is that just because you are exposed to the vaccine doesn't necessarily mean you're going to get cancer, right?
Correct.
Whether you've had the vaccine or not.
Correct.
But we do know that the vaccine, if you get it, is almost 100% protective.
It very significantly reduces the risk of having an HPV infection.
So cancer of the cervix and cancer of the throat in both men and women.
Yes.
There seems to be some research indicating that millennials are lagging in their response of getting that vaccine scheduled. Mm-hmm. Is that, again, that sensitivity, about whatever moral complications they bring into the question?
I'm sure that's part of it. It wasn't part of our survey, but just sort of understanding what the mindset is of millennials and of our younger generation. It's also of the parents of that generation, right? The fear
Sure.
of vaccines and the side effects of those vaccines.
Yeah, but I think education, as you have already said, is so important. I mean, if you can get a vaccine that can potentially prevent cancer, no matter what kind of cancer it is, you ought to do it.
Yep.
And it's been around long enough that there is no good evidence that there are long-term side effects of this vaccine, right? Any adverse, untoward side effects.
Correct.
All right, let's talk about skin cancer. The most kind of cancer that there is, but it's on the rise.
It is. One thing to take a step back about, though, is that when we talk about skin cancers, it's not just about melanoma, which is the more deadly form, so to speak, of skin cancers. It also includes basal cell carcinomas or squamous cell carcinomas, which are typically benign. Most important thing are skin surveys and frequent checks.
You can do that yourself, or should you have your physician check it periodically, check your skin?
We know our bodies well, so I think it is important for us or our partners to help in surveying the entire body periodically, but no one can do it like a care provider.
A personal story, I worked in construction all of my college days. I grew up on my grandparents' farm, essentially, so every summer it was baling hay and never had a shirt on. And Grandma's expression was, they look so healthy, they're just brown as berries.
Yeah, bronze.
And she loved that. And so I knew I had to have this checkup. I walked through the door, and before I could even open my mouth, the dermatologist grabbed my wrist, still maintaining eye contact with me, and he said, "We'll be taking that one off right there." And he pointed to a mole that turned out to be squamous cell. Mm-hmm. And they do a procedure frequently called the Mohs procedure, mm-hmm. which is impressive to me because skin cancer is one of those cancers where if you get it all off of there early enough, you're cured, right? So how does that Mohs procedure work? It's kind of a sampling of the tissue area.
Well,
so
basically,
that they know.
yeah, what it is you excise the area that appears abnormal and you send it to the pathologist right away, and they can tell you, yes, you've got it all.
I kind of wondered because he was so definitive within 20 minutes of having that sample
And
tested.
If it looks like there's still some cancer cells at the edge of the part that he took out, he or she can go back and take a little more.
That answered that.
Yeah.
It's remarkably minimally invasive.
Yeah.
It's pretty good.
Simple to do.
So, what are we looking for? What should people be aware of with regard to skin issues? And if they've got a mole, what should they watch for?
So the key, again, I think the theme is prevention. So you were talking about sun exposure, and I think we've all had this mindset that it's better to be brown. It's really not. Sunblock, covered, layers of covered protected clothing as you're outside. Don't go into a tanning bed, for crying out loud. So again, all of those preventive measures. And it is also, even if you are avoiding the sun, it doesn't mean that you are immune, and we all have moles, and we need to continue to do skin checks.
Another deadly cancer, if not caught in time, certainly is colorectal cancer.
Yes.
How did that arise within your survey? Can you give us a little bit of background there?
So the questions in the survey relative to colon cancer were related to screening. So we have the Cologuard test, which is a non-invasive stool test looking for tumor-related DNA in the stool. Many people are aware of Cologuard, not everybody, remarkably. Again, it's a conversation between an individual and their provider. There are certain indications for when Cologuard is useful. It does not necessarily replace the colonoscopy. So again, there's specific indications that we need people to be aware of.
So the colon cancer, is really quite curable if caught early, correct? Just like melanoma is quite curable. Most skin cancer is very curable if you catch them early. So the problem with colon cancer is that the gold standard for detecting it has always been colonoscopy. But you have to take time off work. It's expensive, and the prep is, you don't even want to talk about it.
That's right.
But this new test allows you to send a sample from your own home. The test was developed right here at Mayo. And send it to Madison, Wisconsin, and they'll tell you whether or not you've got colon cancer. It's unbelievable.
It is, and so the question is, why aren't more people doing it or at least aware of it? And that's the education piece that we need to embark on.
Well, the number of people who are getting it has grown exponentially, but there are a lot of people who are 50, 60, 70 years old in this country who have never been screened for the reasons that we talked about, because colonoscopy was the only way to do it, or a fecal blood test, and that wasn't very good, and it wasn't very pleasant either. So I think this is a huge advance, don't you?
Absolutely. Looking for DNA, whether it's in stool or blood, is where we are in technologies right now. So this is the beginning.
And I think this company and the people here at Mayo are also working on a blood test to detect certain kinds of cancer. And
Yes, they are.
should that happen, when that happens, it'll be huge.
I'll say when.
Yeah, I hope so. It's so good to have you here, sharing the information from the latest Mayo Clinic survey with us, letting us know what you found and what the future holds. And what does the future hold? We're going to cure this disease, right?
Yes.
Or at least be able to live with it and live well
better
with it.
Yes.
All right, we've been talking about the Mayo Clinic National Health Checkup Survey with medical oncologist Dr. Minetta Liu. Dr. Liu, thanks so much for being with us.
Thank you for having me.